Okay. For today, we shall discuss in detail yung tinatawag na spleen 6 descending technique. Okay? And this technique can change the entire energy situation in the triple warmer with one sweep. No, it has two indications. What are they? Kidney yin deficiency with ascending fire heat. Okay, so ibig sabihin medyo matagal na po yung kanyang kidney yin deficiency, nagkaroon na po ng heat, no? And another indication is when you have fullness in the middle, cold and weakness in the lower, ascending damp heat to the upper warmer. So let's start with the very common kidney yin deficiency with ascending fire heat. So this is very common sa mga peri-menopausal women. So women out there who are not so young anymore, okay, please listen. Or in hyperactive children or in anyone else na may dryness and heat in the kidneys. Heat will rise upwards, attacking the upper warmer, and this will create heat symptoms. Ano po itong mga heat symptoms? Hot flashes, sweating, mental restlessness, insomnia, tachycardia, and even high blood pressure. So the treatment is we try to descend the heat back to the lower warmer, okay, and balance it by tonifying kidney yin and sedating yang. So parang, okay, since we want to balance things, we need to tonify kidney yin and sedate the yang. So spleen 6 descending technique is very, very needed here. Another situation when we have fullness in the middle, cold and weakness in the lower, ascending damp heat to the upper warmer. Okay, this is a common picture seen in Western men. Hindi lang yata Western, pati dito na, no? Okay, with beer belly, diba? Beer belly, where the dampness from fatty foods and heat from the alcohol stagnate. So this is something that everybody should remember, no? Especially those who can relate. Okay, beer can actually give you dampness, and the heat from the alcohol will stagnate. No, there will also be heat. The lower part of the body seems to be weak and cold, so with poor function of the reproductive and urinary systems. The full middle warmer, okay, malaki, does not flow downwards. Kasi dapat nagpo-flow siya downward as it normally should. Its flow seems blocked. Okay? The stagnant damp heat flows upwards to the upper warmer. And this causes symptoms of red face, hot head, high blood pressure, tachycardia, excessive speech, and mental restlessness. Okay, kaya pala, insomnia and respiratory tract infections. Treatment, unblock the energy flow between the middle and lower warmer so that the energy from the full middle flows downwards, okay? And the pseudo-heat symptoms in the upper warmer will disappear automatically. Ipapababa nyo. That's why we need to learn how to do the spleen 6 descending technique. Now, this is contraindicated in conditions where the blood pressure is low or the heart is weak, bradycardia, arrhythmia, and angina pectoris, because it creates a depression in the upper warmer energy. So if there is already weakness in the heart, it could get worse. So please take note of this, no? So the spleen 6 descending technique is performed on spleen 6 point alone. Wow. Okay. It can bring down the heart rate within 1 minute and the blood pressure down within 10 minutes. So please take note. It can be usually used up to 3 times in the first week of treatment. So 3 times a week, no? And thereafter only once a week. Okay. So the needling technique is described. Okay, number 1, the patient should lie supine for this treatment. No other needles should be in the patient at this moment. Okay? If you plan to use other points, they can be needled later during the same session or should have already been so, and the needles. So kung meron na po, tanggalin na po yung needles. So needle spleen 6 bilaterally, just deep enough to stand. So not so deep, as long as nakakatayo yung needle. Okay? Stand at the foot of the patient and cross your hands. No? Your right hand on the patient's right leg and the left hand on the left leg, and then twirl the needle. Okay? So with the thumb first upwards and then down pag babae. Okay, pag lalaki, with the thumb first downwards and then up. Do this 6 times. So take note, iba pala pag ano. Any comment here, Ma'am Neeps? Okay, have you done this before? Okay, so pag women, you do, okay, upwards muna sa thumb and then down. So up then down. Gagawin yang to yin. Tapos yung lalaki, thumb first downwards and then ano. So it's the thumb that will do the manipulating. Then tell the patient to inhale through the nose, swallow once, not to swallow air, and exhale through the nose. Okay? He or she should continue this breathing until you instruct them to stop. Okay? Then insert the needle in at spleen 6 as deep as you can without twirling. If you encounter the tibia, no, ito po yung most likely na maninidle mo, matatamaan ng needle. Do not insert further. Repeat the twirling again at the deep level, and this time, in both men and women, twirl needle with the thumb first downwards and then upwards na 6 times. Do 3 lifts and 1 thrust, repeating several times, with the needle becoming gradually more superficial. When the needle is just deep enough to stand without falling flat, leave the needle in place for 1 minute. The patient should still continue with the breathing, okay, as instructed. After 1 minute, prepare to remove the needle. Instruct the patient to change the breathing pattern, keeping his or her hands on their stomach. They should inhale through the nose and exhale heavily through the nose and mouth, and pull their stomach in while exhaling. Actually, this is an indication na lumalabas yung air when you're pag nag-exhale ka, no? Pag ililiit mo yung stomach in. The needle should be removed at the 6th inhalation. So